More than 2 million Americans are sickened each year by hospital-acquired infections, resulting in over 90,000 patient deaths. And $1.7 billion is spent per year on infections from medical care. If you could do something about that, wouldn't you want to? With the latest scientific research going into every aspect of the patient experience, the nation's healthcare facilities are striving to provide the best possible environment for the care and well-being of their patients and staff.
We have an environmental firm, and part of our services have always included a lot of hospital-related work. And the more we worked for hospitals, eventually they started asking us for more specialized type services. We do 14 different tests, and sometimes more, depending upon what the hospital or the ASC asks for. But we're also testing for things such as MRSA or staph, as well as insect parts that are other things that are even microscopic to the point where no one will ever notice.
Wellington Infection Control Services has its finger on the pulse of today's healthcare needs, with cutting-edge air testing procedures during renovations. These procedures have been shown to reduce hospital-acquired infections in ways never before possible.
We also look at dust migration studies for construction companies. So sometimes it's not just a construction company, it's the hospital that they want to understand, is there dust migrating from a construction site to an area where we have patients with low immune tolerance levels.
In addition to environmental testing, every facet of medical care is being scrutinized for ways to aid in reducing hospital infections. Advances are being made in the design of patient rooms and ORs, as well as the materials used in critical care and recovery areas, providing a safe, healing environment for patients and their families.
The main focus we have in the patient room itself is making sure the sinks are located right as you enter the room for a caregiver, and then making sure all of the surfaces that are within that room are durable and cleanable. As you see here, we have flooring materials. They're all sheet vinyl products that can be heat welded. They have the finish of a stone, the look of wood. They give that warm residential feel without being porous and hard to clean. So that's the flavor of the kind of the direction healthcare design is going, is having these finishes that are extremely durable and very easy to maintain, but also having them give the softness that we need for those patients.
Besides the goal of providing safe care, medical facilities understand a high infection rate can have a detrimental effect on financial performance. Also, new legislation contains reimbursement penalties for infections that will directly impact each hospital and ASC. In addition, Joint Commission site survey teams often ask for documentation to verify a medical facility's performance in its environment of care. The scientific data collected during testing is also being used to satisfy this need, and there are several other motivating factors.
So legal action is a big issue right now. Sophisticated lawyers nowadays are starting to ask for hospital records with regards to maintenance and with documentation that things are operating correctly. Another one that's starting to emerge are insurance companies. The insurance companies that provide the coverage for these critical rooms are writing the policies to state, we provide you with this coverage as long as the rooms are functioning the way that they were originally designed. And if they come in afterwards and test and find out that it's not functioning correctly, then it's reducing their payout and it's increasing the amount that the hospital has to end up paying. So we're that buffer to make sure, you know what, our rooms they're working right.